Assalamu alaikum. May peace be unto you. My name is Sameera Ahmed, and I'm the director of the Family and Youth Institute. I'm also a scholar at ISPU, the Institute for Social Policy and Understanding. And I'd like to start off by thanking ISPU for inviting me to speak and share my thoughts and experiences in the research that I've done over the last few years. Today, we'll be talking about identity, intersectionality, and mental health, and working towards creating positive Muslim mental health in our communities. Now, before we begin, I wanted to share kind of an understanding of looking at what's going on around us. With the recent murders of individuals such as George Floyd, that's had an impact on many of us. And for us, it highlights how important this conversation is when we talk about mental health. When I think for myself, an individual who is not Black, the impact was obviously the hurt, the anger, the frustration, because I have loved ones who I care about who are Black and who are impacted on a daily basis. But the impact it had on me is very different than that of my friends who were Black. And for them, it wasn't just the death of George Floyd, but it was also triggering and reminding them that despite who they are, whatever professional accomplishments they've had, despite despite all that, in addition to that, the fact that remembering countless times of individuals that they cared and loved for were shot, were killed, were taken away from them. They themselves, their lives were impacted, and they had moments where they didn't know if they were going to be able to make it. All of that trauma, all of that triggers had an impact on them in a much more deeper, profound way. And if we're not able to understand how their identity as a Black Muslim is important for us to consider when we think about mental health, we're really missing the point, and recognizing that really identity and the intersection of both their Muslim identity and the racial identity, or for other individuals, the intersection of the socioeconomic identity and how that has an impact on how they experience the world, we're missing a huge part of mental health. And so today I really want to focus on explaining that and helping people understand why that matters. So when we think about identity refers to our individual qualities, kind of our physical health, our personality, our experiences that make us who we are, right? And this is profoundly impacted by our social impact, by our social environment and context. And so when we think about social context, there are different aspects that we need to consider, the different layers, so to say. You have microsystem, which is the immediate environment that we engage in our daily activities or interactions. And that often refers to home, school, masjid, our work environment. So how individuals in our microsystem treat us will influence our behavior towards others in our environment. So an individual who is constantly feeling that they're not welcome, constantly being harassed, profiled, that environment is going to have an impact on their development as well as how they see themselves and how the world is interacting with them, right? So similarly, the mesosystem is the interaction of the different microsystem, the family interacting with the school interacting with the masjid, all of those aspects that the individual finds themselves in. And if there's positive interaction between these systems and they're reinforcing each other, then that's helpful for an individual. However, if they're in conflict with each other, that increases stress. And the degree of difference and the degree of stress can have varying impact on the individual. Similarly, when you think about the exosystem, there is an interaction that the connection between two or more settings that we need to consider, one of which may not contain the individual but may be impacted indirectly. And so an example of that would be if an individual's spouse or an individual's parent is in a very stressful work environment. While the individual isn't impacted directly by the stress at work, their parent or their spouse may take that stress out and come home, and that may have an impact, negative impact, either viewed as irritability, anger, frustration, and the individual experiences that, right? And then there is a macro system impact, and that is the impact of the individual's development is influenced by what's going on in society, what is going on in the national conversation, what are the different factors, the economic situation, the sociopolitical, that permeate throughout society. And so for us to recognize that an individual is living within a particular social context, and that social context has an impact on their identity and has an impact on how they see themselves and how they interact with the world. It also has an impact on how they see themselves. So the next thing we need to think of also is, as individuals, we have many different social identities, right? So an individual's sense of belonging to a group is really it refers to, does an individual feel like they belong to a group? So an individual might be Black, but they may not identify themselves as Black. They might be Latino, and they may only identify with the Muslim community at the expense of the Latino community, right? And so does an individual identify with their group or not? Now, what determines if they identify with the group really is dependent on, does the individual see themselves as part of the group? How do they evaluate and see the group? How important is that group to their overall sense of self? How emotionally connected are they? How much are they engaging and involved in that group? And what's the content and meaning and the historical significance of being part of that group? Right? So dependent on all of that, in addition to what they're experiencing by society, an individual may identify with a group. And if they do identify with a group, it's depending on these factors I just mentioned. And that group identity influences their personal identity, right? And that identity can be constructed by others in their environment, or such as society, such as through the media, through interactions they have, or that can be constructed by the group. And so this concept of identity, how does one see oneself, is developed by, one, how you see yourself, but also how are you identifying with other groups? Be it, do I identify as a Muslim? Do I identify as someone who is white? Do I identify as someone who is a female? And whichever identity or identities are meaningful for you really has an impact on who you are, how you experience the world, and then also really how you're interacting with those around you and how others treat you. Now, when we think about this, we think about, okay, so we have, if you identify as a Muslim and you are experiencing or you're seeing the anti-Muslim racism within our nation, right? You're seeing it at multiple different levels. You may see it at the systemic level, right? And at that level, you might be able to recognize that you have this history within our nation, which has had anti-Muslim laws in place. And another ISPU scholar has done a lot of work looking at Islamophobia, American Islamophobia, Dr. Khalid Beydoun. I recommend his book, American Islamophobia. But what you see is, you see this historical system in place. You also see institutional anti-Muslim hate, Islamophobia in place through the Muslim ban, government surveillance, through CVE and Patriot Act. You also see kind of the interpersonal Islamophobia that's taking place through one-on-one interactions. And then as a result of this, we are increasingly seeing internalized anti-Muslim Islamophobia, right? And so part of that may be people feeling or internalizing that Muslims are backward, wanting to distance from their Muslim identity. And so that's looking at it kind of from a general perspective. But one of the things that we also need to think about is, for example, internalized anti-Muslim Islamophobia. What does that look like? Well, one of the research studies ISPU did with the American Muslim poll in 2018 was to identify that Muslims were most likely to believe that their co-religionists were prone to negative behavior. And to me, that's kind of an example of internalized Islamophobia, that they think worse of themselves and their community. But that's looking at it from one level. Now, if we add in the concept of intersectionality, which was introduced by Kimberly Crenshaw, which was initially introduced to look at oppression of women within society, the oppression of women of color, what we see is there's another way of looking at that and that data. And that is to really account for the different identities an individual may have. And those identities may combine together to create a unique experience. And so when we think about that in terms of psychology, intersectionality allows us numerous different phenomena that look different for different groups of people. And so when you do that, we recognize that we're able to now look at discrimination. We're able to look at health disparities, identity development in ways that are different for different individuals. So when we think about intersectionality, it also helps us identify the different injustices different groups of a particular category may feel or experience, and look at the different factors that work together to create those situations, as well as work towards change. And so when we think about these social identities, we think about gender, race, economic factors, educational background. When you put those identities together, it has a very different impact. And so we look again to the research on Islamophobia that ISPU did in the 2018 report, and we see that, okay, Muslim women, well, the information talked about Islamophobia, Muslim women were more likely to experience acts of hate. And that younger folks, ages 18 to 29, also experience that. And so then the question then becomes, well, what does that look like for a young Muslim woman experiencing Islamophobia? And if you add the dimension of race, and you add the dimension of educational background, and you add the dimension of socioeconomic background, how does the experience differ, right? And so those are the questions that it's really important for us to understand as researchers. And I would encourage, because Muslim mental health is at an infancy stage, that those who are studying these issues and topics, that you do engage in mixed method approach, where you're looking at not only the numbers, but also the experiences of individual groups of people who are experiencing some of these stresses, so that we can better understand what does the intersection of these identities look like and feel like and mean for groups of people. And so for that, I've done some work on this topic, which really looks at, for example, one release that we just had at the end of last year is looking at Black Muslim youth and really understanding what are the different factors impacting their development and their experiences. And then what we as a community do to address those different factors. We can strengthen. And another topic looking at different experiences is a report that we did looking at bullying and anti-Muslim racism for young people. What does it look for young people within a school context? What are the issues? What are the challenges? What does it look like, feel like? And really provide that as a resource. Similarly, another work that I worked on was looking at converts and the experiences they've had. And so when we think about it from a mental health perspective, what are the different nuances that we need to consider? What are the conversations we need to have? What are the different aspects that we need to consider that may affect treatment? And really going through that. Another area is to really think about refugees. Oftentimes we lump refugees into the category of immigrants and study them in that way, but really it's important for us to understand, what does the experience look like for them? How was their experience? What was the situation for them in their home country? How did they leave their home country? What was the process they went through? And really understanding the nuances, because some of these issues related to mental health will be really influenced by these experiences. And to really account for that is extremely important as we go through them. Now, when we take all of that information and recognize that, yes, we are a large community, American Muslims are unique, they are diverse, they have multiple different subgroups, which are due to the different identities they may have. How do we then take that information and promote healthier Muslim communities? And so when we talk about this, we recognize that there is a mental health impact that we are experiencing. First of all, up to 25%, 1 in 4 individuals report anxiety. 1 in 3 individuals report mood disorders. And the question though is, what does that look like for different individuals with intersecting identities? For example, we know that depression is experienced by Muslims, and however, the sources of stress, the experience, the treatment intervention, and support may differ according to individual. So for example, a Black Muslim sister who has been dealing with the effects of structural racism throughout her life, her parents, it has impacted her parents and their opportunities, right? And experiences they've had on a day-to-day basis, the everyday insults, right? That her experience, her trauma is different than someone who is an elderly Syrian refugee who has had to leave their country immediately and transport to America and live away from family and friends. And so that situation, it looks very different, but they both are causing depression. And so what you do for them and how you help them may be very different. And so the thing is, what we really are looking for is, how do we build resilience for our community? How do we treat those individuals appropriate for their cultural context, their realities and their identities? And so part of that is to be able to provide unique community support opportunities, depending on the different social identities, so that we can harness that to promote mental health for the individual as well as their community. And so what I really also want to focus now today and kind of pivot towards is, okay, what do we do with that knowledge and information? And so if we take that information and we think, okay, now here we have these different situations, what do we do? Now, traditionally, we talk about a medical model. And the medical model looks at specifically that individual who may be experiencing depression, and then helps that individual either decrease and manage their specific case. But then there are all these other individuals who weren't able to get help, weren't able to reach out to a therapist, a psychologist, a social worker, or a psychiatrist, and they weren't able to make their symptoms more manageable. What do you do for them? And so for them, one of the things that we really need to start doing is really taking a public health model to promote mental health and well-being. You know, for those of us, we're going through the pandemic right now. We were able to see how public health officials were able to mobilize our country to make major behavior changes and lifestyle changes so that we can save lives. Similarly, we need to be able to do that with mental health within Muslim communities. And so part of that is to really understand, how do we help those individuals, those thousands of individuals who may not be able to reach out to a therapist to get the help? What are the different factors that are preventing their ability to get help? That might include, really raising awareness about mental health within the community, addressing the illiteracy that we have. It could also be really reducing stigma addressing the barriers that exist, to be able to also give people resources that actually can make a difference. And so really thinking about how do we mobilize our community in such a way that we're able to promote mental health wellness. And so that's what I spent the last 10 years of my life really trying to address. And the way I've been doing that has been working by forming the Family and Youth Institute, because that is one way we're trying to use that public health approach to mental health wellness. Now, the organization is a community-based organization that promotes and focuses on mental health wellness through providing original research and education that is religiously and culturally tailored for American Muslims. And again, we do that through researching the issues that impact them, to educate individuals based on that research so that we can empower them in their communities. And if you'd like more information about the FYI, you can find that information on our website. Now, typically, when we share this information, we're sharing kind of the basics of the model to the community. But given that this is a scholarly conversation, I wanted to share a little bit more detail so people understand how are we really trying to implement this approach using varying different models. So looking at this, we have the model that we use is a public health model, but it's also based on community-based participatory research model for promoting wellness. And so kind of discussing what this all means, because I know it's a lot, and I apologize, but it kind of puts it all together very succinctly, is we recognize that mental health issues do not happen in a vacuum. They happen within a context. And when we look at the different contexts, we need to consider what are the social and structural factors. We just all the different, the mesosystem, the microsystem, the exosystem, all of the systems, like what does that look like for the different individuals? And then when we think about the actual community, what does that look like? How important is mental health? How is the national and local policies impacting individuals? We think about the Muslim ban, when we think about other factors, CVE, how is that impacting mental health and well-being within our community? How ready are our masajids? Do they have the capacity and readiness to address mental health issues? Do we have the trust for interventions to be taking place within the community, or is there still more work that needs to be done? And so really taking a good look at our context, at our national context, at our local context of readiness and where people are to really work on mental health promotion. And then as we move from the context to really working towards intervention and research, you can't do that by yourself. And we recognize that. And so we need to develop relationships and bring partners in this large project of building mental health well-being within our community. And so that includes the importance of the communities, be it the community-based organizations or the masjids. Also includes academics who we need to help do the research. We also need funders to pay for this work that we really want to do. And that all of that partnership process is meant to work together to identify what are the research questions that we have, what is most pertinent to the community, to empower them in that process of understanding and conducting research, to integrate the community knowledge. We might see that something may work within certain communities, but we don't know if they work in other communities. And so we can test that out. Or we can say, these similar communities, it seems to work, it's not working in this other community, what factor did we miss? And so really integrating the feedback partnership with our communities that we're working with to produce outputs, resources that are religiously and culturally centered, that are meaningful and are more likely to be used. Use that partnership strategy to promote mental health well-being. I can produce a great resource, but if nobody's using it, what's the point? And so it's only through that relationship that we have with communities, with other organizations, that we could help promote wellness within the community. And having that process also allows us to ask and understand and design better research studies. So in that process, the hope is, as we're doing this, that we're able to make changes within, within the community that will really help promote mental health. And so part of that would be really making changes in kind of the policies that we may implement, the mental health policies and resources we have within our communities, to really help start interventions and then sustain them over time so that they're independently run, to really address the power issues that maybe exist within our communities, to really identify and understand how do we use our faith and culture to promote wellness within our communities. How can we help our communities increase their capacity to meet the mental health needs within our communities? And in that process, we're also trying to decrease the health disparities that exist within Muslim communities. And we're really trying to increase our efforts to greater social justice. Now, when we look at all this, we have started this process. We have some of the building blocks in place, and there's still a lot to do. But this is the model that we're using to really promote mental health across the nation through relationships with within the Muslim community. And so that's the approach that we're using within the FYI. Now, kind of specifically to that, when we do that, there are different steps that we're taking. One is working with the community to identify what are the most pressing issues, what is the problem. Then working hand in hand with individuals to understand what are the different contributing factors, what are the nuances that we need to really consider. And then looking at solutions, what works, what do we know works? And then how do we make it work for our community? And when I say community, recognizing the fact that there are multiple different communities within our community because of the different social identities we may have. And then when we translate those resources, how can I apply that knowledge? How do we actually make that behavior change that we're looking for? And when we do that, does it actually work? Right? Because we always want to make sure that if we're implementing a public health model, that we are seeing changes over time. It may not be immediate, it may not be as drastic, as quickly as we want, but it is happening. And so when we look at this model that we've been using at the FYI, we take this approach. And so we look at the first step. The first step is to really do that needs assessment. And again, using the community-based participatory approach, we really want to make sure that we are working with the imams and leaders, the community organizers, who are the community gatekeepers who we acknowledge are leading the community, making sure that their input is there, making sure that we're also raising the voices and reaching out to those individuals who are often not heard, and reaching out to marginalized voices to make sure that their issues, concerns are also being addressed. And so we have multiple different ways of getting that feedback from individuals to kind of set the research agenda that's most meaningful for the American Muslim community. And then we then conduct some of the research that we've been doing. And what we've done is, given the realities of our community, we focus on 4 areas that is of greatest concern. And that is really understanding and promoting youth development, understanding and supporting parenting, more effective parenting, strengthening marriages, and promoting mental health, specifically to really address kind of the stigma, the barriers of treatment, the lack of mental health education, and figuring out what are the most effective ways to promote mental health, which is what we've been using this model. And so really looking at these areas of research has been focusing on these areas of research is what we've been doing. And then once you start doing these research studies, you really need to take that information, the research findings, and then make it beneficial to the community. And so while the research is kind of the center of what we're doing, the original research, making sure that it is research informed, We also make sure that we take that research and consider clinical evidence of what will help make that research more meaningful. We incorporate the cultural context and the identities that individuals we're trying to support. And then we also want to make sure that we integrate faith, because faith and cultural identity and context are really important to help make the research findings meaningful and helpful, and increase the chances of it being integrated and behavior change occurring. But we also recognize that one of the biggest challenges is really understanding and addressing the barriers to intervention. And so some of that has to do with maybe stigma that people may have about mental health, or knowledge or lack thereof of knowing and recognizing that that something can be done about an issue. Sometimes it's a matter of access, knowing or being able to access this information. Sometimes it's a matter of cost. And sometimes it's a matter of trust, or even in really building that trust that, is it okay? Can this information be used? How is this information going to hurt me? And really kind of bridging that trust. And finally, having the resources to make that change. And so at this step, we really try to integrate the two to really be able to provide those resources that would help make a difference for our community. But then when you do that, we really need to make sure that these resources are tailored by audience, right? So we talked about the Islamophobia that many people are experiencing. So when we take that and we look at, okay, if we're looking at Islamophobia for young people in schools, then we need to develop resources for all the different individuals that can make a difference and have an impact. And so we need to have research reports for the researchers to understand what's going on. We need to have resources for schools, for teachers, for administration to understand, okay, this is how you understand what's going on. This is what you can do to make a safer environment for your students. We also need to have resources for parents and young people to help advocate for themselves and not know what can they do, what are their rights, how do they go about navigating the system. And so you take that one issue of Islamophobia in schools for young people, and then you develop all of these resources to help support them through that process. And so there are many different resources that we do develop to address that, and so that could be helpful for people. Now we develop the resources. Now, how do we go about bringing about behavior change, right? We've done the research, we understand what's going on, we've gotten the input from the community, we've done all that. Now we're at step 5, which is behavior change. Well, what we know from the research on behavior change by Prochesta and De Clemente is that there are different stages that we need to consider. And so we start off with pre-contemplation, where the individual is not even thinking about any change. And then we want to move them from there to thinking about change, contemplation stage. And so the way we've been doing it is raising awareness through infographics, right? And then from there, we want them to move to the next stage, from contemplation to preparation. How do we get you to start thinking, okay, that, oh, this is really bad, to, hey, this is bad and I want to do something, or this is a real issue for me and I want to do something about it now. And so the videos, animated videos that we have really are meant to inspire change. And then when you think about, you're preparing them for change, but then they actually need the skills, the resources to make those changes. And so part of that are the workshops, the tools that we have to really help individuals, give them the resources, give them the skills to make those changes. But we recognize, even if you give them all that, give individuals all that sometimes there's additional information, more details, nuances that are needed to maintain that change. And so those in-depth information, be it the articles, the daily articles that we share, or the reports, all of that is meant to supplement and complement and help an individual maintain that change over time. And so the examples of how we've done that is when we think of moving somebody from the kind of the pre-contemplation stage to the contemplation stage. Well, for the general Muslim community, one of the things that we've done is we've developed this infographic to raise awareness about mental health. And we actually sent this out, this poster, printed out really nicely, laminated it, and sent it out to any masajid, any community center who want it. And we were able to send it out to 500 communities. And so the idea was for them to put it up within their masjid so that it was visible for all people to look at and to really start that conversation within the Muslim community. Now, this information is not going to be very helpful to a researcher or a clinician to have up in their office. But for them, if we recognize that one of the barriers to getting mental health help is misinformation, lack of knowledge on the part of individuals, to empower researchers and clinicians with something that would be of benefit to them, that would help reduce the kind of stigma people may have to seeking mental health treatment. And so for that, our team of researchers looking at stigma developed a Muslim historical contributions kind of infographic poster that really highlighted for individuals, okay, this is a history of Muslims in the field of psychology, and that we recognize that we have been very much part of the conversation in psychology and mental health. And the idea is for clinicians and researchers to use that to help address mental health misconceptions amongst Muslims. And again, you see these two different features that are being used to help address and raise awareness and move the individual from pre-contemplation stage to contemplation stage, where they're thinking about making a difference and making a change. Then we move an individual from that stage to really prepare them to change. And so, like I said, the animations that we have really help lay down the research in a very succinct way, but then call them to action, call them to, here are the resources, this is what you can do, and prepares them for change. And then we move on to kind of actions. What are the different actions that you can do? And for that, we also provide professional trainings for different audiences. We also provide tools through our toolkits, through for example, the suicide prevention guide that is geared towards the Muslim community, really telling people, these are the different things that you can do. This is a steps 1, 2, 3, 4, 5. Here are the additional resources, and really giving them the resources and skills to take action. And then when we talk at next point is, how do you maintain that knowledge? How do you keep them going? And so part of that is to have those research reports, the articles, the detailed information for people who want to know more, or for daily articles where we're sending out specific articles Monday through Friday where people can improve their knowledge about strengthening families, about mental health, and really improve and maintain these changes. And so these are just kind of, and this is part of the last stage of behavior change of maintenance. And so the next stage is really thinking about, okay, if we are trying to make these changes, are we having an impact, right? Now, so this experiment was started about 10 years ago. And over the last 10 years, if we do look at the impact, we are seeing the needle change in a more positive direction. We are seeing increasingly more mosques and communities talking about mental health. If you think about with the current COVID crisis, so much more programming on mental health has been done by the FYI, as well as many other organizations and individuals that really highlighted the conversations that are necessary and required and the desire to address that. And so part of that is, looking, have we made that impact that we started off? And what we see is, yes, we have made that impact. Again, we can't take all the credit for it, but we can say that we know for ourselves, the work that we've done using this model, we've really reached out to individuals. Almost 36,000 individuals, adults, have really used our parenting resources. We know that at least 4,000 have used the resources that we have to identify and support young Muslim kids who were being bullied. We know that 8,000 individuals have have attended our programming and enhanced their specific parenting skills for those parenting workshops or lectures. We know that approximately 5,000 individuals receive resources every day, Monday through Friday, to maintain the behavior changes that they're seeking to maintain. And so we're seeing the impact in the area of parenting. We're also seeing the area of marriage, because again, the 4 areas that we really focus on is parenting, marriage, mental health, and youth development. So in terms of marriage, we know that over 111,000 individuals have used a marriage prep and marriage strengthening resources that we've been able to provide the community. We know that 82,000 of individuals have really taken the pre-marriage consideration infographic and used that in their kind of conversations about pre-marriage for themselves, for other people they care for. We know that at least 30,000 individuals have utilized our online marriage resources. And we know that more than 5,000 individuals have gone through our intensive skills-based relationship strengthening presentations, as well as 8,000 individuals have looked at our resources online and used those tips to develop healthier marriages. And so what we're seeing is we're seeing a shift in how people's marriages, the resources are being used, how that is used to strengthen Muslim marriages, which then has an impact on individuals' parenting, mental health, and youth development. And so when we look at youth development, again, we've reached more than 223,000 individuals with our youth development resources. More than 156,000 have relied on that one specific infographic that really starts a conversation about risk behaviors of Muslim youth. We also know that 35,000 individuals have turned to our online resources for youth development, be it the toolkit, the research articles, the reports, etc. But people are reading this information, those resources that we are providing to change the conversation, to strengthen Muslim communities, to promote mental health wellness, that is happening. And so really, that's exciting to see that this model is working. And recognizing that 54,000 of parents and educators have learned skills and tools to better support their young people through the workshops and lectures we've done. And then when we finally come to mental health, again, we're seeing that 92,000 have looked at the resources, have integrated these resources. More than 25,000 have attended mental health workshops. More than 65,000 have accessed our mental health resources online. More than 8,000 have used Just the Grief support toolkit. And at least 4,000 people have relied on the suicide prevention toolkit. Again, what we're seeing is the needle is moving towards more positive conversations about mental health. And so this is some of the impact that we're seeing. But again, there are many considerations we need to really think about this model. This is first of all, one of many models that are of individuals and organizations who are working to promote mental health. One challenge we have is that the organization is not university affiliated. While individuals within the organization are affiliated, and that is where we get our IRB and grant funding that we can get, but the institution is not university affiliated, and so then are not able to apply for some of the larger funding. And so that's a consideration to think about it. Is that the most effective way? What can we do? Should we do something else? And there are pros and cons for that we have been going back and forth on. The second consideration is this model, the success is heavily dependent upon community support. It was designed that way. It is meant to center the community needs. And so if the community is supportive, then the model will be supportive. If the community is not supportive, if the trust disintegrates for whatever reason, then this model will not continue. And so that's another consideration of this model, which has its pros and cons as well. But for us, it is our pro that we want to make sure that the work that we do is embedded within the community. The other consideration is this model is attempting to consider the different intersecting identities of the Muslim community and is not focusing on only one subgroup within the Muslim community. Again, there are pros and cons for this. We've chosen to integrate the needs of the entire Muslim community, but in doing so, we may not be providing for one specific community, and there are pros and cons to that. And I think for as a community to promote mental health wellness, we need both to exist. Another consideration is to really focus on those who identify with Muslims. And so individuals who who may have been born in a Muslim household, but do not identify with Muslims are not provided resources through this model, mainly because of people have access to these resources, but the research is not focusing on those individuals. And part of it is bandwidth. But really, this is based on those who self-identify as Muslim. Another challenge that we have is really measuring the impact of our work. We have identified this, and this is based on our data, but we know through, for example, a lot of our resources are shared through WhatsApp. So really trying to figure out how do you measure that on WhatsApp. And so most of what we've been able to do is really measuring what's going through our website, on Facebook, on the different social media state, not really looking at what is happening and being able to measure on how other people are sharing. And so recently I had a friend who came back from one of the Scandinavian countries and came back and said, really thank you ISPU and the FYI for the work that you're doing. But I had no understanding of the impact that we were having in those countries. And so really understanding that being able to measure the impact of the work, while we're able to do what's limited based from our kind of abilities, that impact may be much larger than we realize. And finally, another major consideration is all that we've shared has been self-report. We really do need an external model evaluation to really verify that the impact is what we're seeing. And so that's one of the things that we are working towards. Finally, to conclude, I've shared a lot. And the points that I want us to take home and go with is to recognize that when we are talking about mental health, that we have to understand the different components, the different intersecting identities, and how that experience has an impact on mental health. I started off sharing a situation of a current context. But if we would have just left it as, okay, these individuals are both Muslim and this is the Muslim impact, not taking into account race, not taking into account educational background, not taking into account kind of socioeconomic conditions, we would have lost a lot of information. And so really highlighting the importance of mental health, of really recognizing the different identities that may have an impact, and integrating the intersecting identity to see what is a unique experience for individuals. So that's the main point that I really want us to go away with. The second is to recognize, particularly for individuals who are thinking about going into this field, is to recognize that we're really in the infancy stage in Muslim mental health research. And there's a lot of work that needs to be done and a lot of exciting things that you can do. And so really thinking about what you can do is going to be really important. And like I said, this is one model to strengthen Muslim mental health. There are other models, and so those other models need to be also looked at to see how can we get the best model to help promote mental health within our communities, and how can we collaborate to make that happen. And so for future scholars, individuals who want to go into this field or in this field, what I would recommend is really in your training to take an interdisciplinary approach, because this work is going to require interdisciplinary skills, and to learn how to collaborate professionally across those fields. And then really think about the importance of taking a community-focused research approach. Really, community-based research is really important because you're really addressing the issues that are impacting the community, and your implementation will be much more effective if there is that kind of partnership process with the community, as opposed to theoretically addressing an issue, identifying, discussing, doing the research, but it doesn't have any impact for communities. And in order to be able to do that, really, you need to have community building, trust building skills, ability to organize, and learn to work with individuals across different organizations, across different mosques, and really have that skill set. And I would encourage you to go into community-based participatory research and really think about other aspects of how can we address mental health issues for our community. And I provided you one example of what I've been doing for the last 10 years to really promote mental health from kind of a population perspective through the work of the FYI. If you would like more information about the organization, the website is listed, www.fyi.org. Feel comfortable to look at our website. You can contact us. We're also available on social media, Facebook, Twitter, and Instagram, and contact us, ask questions, provide feedback. This is a community-based model. We are learning and growing each day. And the feedback that you give based on what I've presented is really, really helpful. And you can reach out to the ISPU. I think they're going to try to coordinate any questions people have, and we'll try to get back to you as soon as possible. And again, I thank the ISPU for providing this platform, allowing me to share kind of the thought building, the model that we are working on to promote mental health nationally. And we look forward to everyone's feedback. Thank you.